In contemporary classrooms, the role of teachers is particularly complex due to the increasing educational needs of diverse students. We will role-play to show 2 challenging behavioral cases out of many other significant behavioral issues we may face in early childhood settings. Analyze the recent census report and then explore how we may incorporate early intervention pathway and social inclusion support to enable all children's learning and participation. Our focuses are understanding autism spectrum disorder, incorporating early intervention, and classroom implementation. Please view the 2 video clips performed by all of our team members.
Jay is 3 years old and has been diagnosed with autism spectrum disorder level 3. Jay is always happy to be dropped off at childcare but struggles to socialize with other children. He doesn't like to share toys or having children sitting next to him during play. If a child interrupts his play or grabs one of the toys he's playing, Jay reacts by scratching or biting the other child. When this kind of behavior is displayed, the children in the room get scared and move away. Jay isn't able to understand other people's feelings. It's okay to have one-on-one time with him to support him during play. Jay displays obsessive behaviors during play, such as lining up toys and play with spinning objects, watching the object going down over and over again. He also has some sensory needs and often puts toys in his mouth. Jay isn't able to communicate his needs. He makes a high-pitched noise such as da. He often pushes the educator in a direction when he wants something or grabs our hand. Sometimes when it's clear what he wants, Jay often gets upset and asks for carols. Jay expresses excitement by hand flapping with both arms and with a happy facial expression.
Now we're going to show you how Jay reacts when his play is disrupted.
Let's go see what we have here. Let's go see. Look, you can sit down. How about we collect all this and start again? Are they all yours? See, they're all there.
H displays behavior that educators are struggling with. She's not medically diagnosed. However, the behavior still disrupts the daily routine, results in educators feeling physically and mentally exhausted. H behavior is disturbing the whole class, and it's very confusing for the educators as they can't predict what to do to keep her emotions stable during the day. It is putting a lot of pressure on the educators to try and respond to her needs while being attentive to other children. Now we're going to see how it is for H to be dropped off early in the morning.
Honey, let's go. Let's go quick. Mom has to go. Honey. Hi, look. Who's here? Who's here? I'm happy to see you. Maureen's here. Good morning. Honey, welcome. Look, your friends are waiting. Oh, your friends are waiting. Yeah. Look, friends are here. Mom's gonna be here soon, okay? Mom's gonna be here. Mommy has to go to work. She'll be back soon. Mommy always comes back every day.
Honey, seriously, I have. Okay, she's yours. Bye. She's yours. Bye.
Are you okay? Are you okay? You have to leave. Look, I'll leave you for 5 minutes. When you're ready, we are all here. We're waiting for you. I'll leave you. I'm here. When you need me, I'm right here with you.
From the above videos, it is evident that educational needs of diverse students have increased significantly. The diverse learning abilities may encompass extensive physical, intellectual, cultural, and behavioral differences, along with others. These barriers to learning and participation may arise from disability, behavioral issues. Gifted children may also face these problems, cultural and linguistic issues, and developmental delays. Sonia will talk more about the Australian Early Development Census findings.
In this slide, you can see the Australian Early Development Census. It is a nationwide data collection that shows how young Australian children have developed as they start their first year of full-time school. 99.9% of children were experiencing developmental vulnerability in one or more domains in Victoria in 2021. The AEDC highlights what is working well and what needs to be improved or developed to support children and their families. This is based on physical health and well-being, social competence, emotional maturity, language and cognitive skills, school-based, communication skills, and general knowledge. On the next slide, my team member Adi will be discussing about the complexity of a teacher's role.
Why is teachers' role complex? As the number of diverse learners increase significantly in our classrooms, teachers need to apply a variety of teaching skills, pedagogies, and develop more skills that will provide us with the knowledge to cater for all the children with different needs and abilities. It's also important to be aware of the red flags and notice which might be a sign that a child would need extra help or support. In addition, working in partnership with families is crucial to ensure the ultimate benefit for the child who would require extra support. And also it might require collaboration with other professionals. Teachers' role is complex. Being part of having an inclusive classroom, teachers need to have the time, knowledge, and understanding that would support the child regardless of their abilities or disabilities. And now we're going to move to Jinan, who is going to tell us more about the developmental delay and autism spectrum disorder.
Some of the children's behavior issue could be a part of developmental delay or developmental disorder. So on next two slides, I will present our understanding of developmental delay and autism spectrum disorder. First, I will have a broad discussion about the difference between developmental delay and the development disorder. The NDIS defines developmental delay as a child developing in a typical manner but is developing more slowly than other children at his or her age. However, the developmental disorder or disability is when a child is not developing as expected or atypically. A disorder or disability must be diagnosed by health professionals. There are different terms for disorders. For example, mental health disorder is also called emotional and behavior disorder, including ADD, ADHD, conduct disorder, anxiety, depression, bipolar disorder, and schizophrenia. That sometimes could be seen in the early childhood setting. I will present our understanding of autism spectrum disorder on the next slide. Autism is a developmental disability that impacts communication and social engagement. Autism is often, but not always, linked with a physical, developmental, or mental health condition, such as intellectual disability, epilepsy, ADHD, dyslexia, anxiety, or depression. Children with autism spectrum disorder often find it difficult to build a social relationship with others. They have difficulties in social and emotional interactions, such as trying to avoid eye contact, having difficulty sharing their feelings and understanding other people's feelings, not responding when his or her name is called, repetitive behavior and restricted interest, or sensory overload, either overstimulate or understimulate. Some of them may require extremely fixed routine. Most importantly, many of the disabling challenges associated with autism come about when children don't receive the respect, understanding, and the support that allow them to be comfortable in a non-autistic world. Next, our team member Heidi will introduce the early intervention for the children with a behavior issue.
What is early intervention? Early intervention programs are distinct from preventive programs since they focus on those who are at risk of developing the disorder or who are exhibiting early or minor symptoms of the issue. However, real preventive programs do not need that a participant be at risk or exhibiting any symptoms of an illness. Why is early intervention recommended? Children who exhibit these problematic behaviors are more likely to go on to experience more severe problem behavior and later behavioral and academic issues if the issues are not addressed early. Numerous studies have shown that young children who exhibit serious problem behavior are likely to continue to do so throughout elementary school and into beginning of adolescence. The best way to manage problem behavior in young children is through family-centered early intervention services. These programs have considerable potential for lowering problematic behavior in kids and boosting families' competence and problem-solving skills. However, as children get older, moving from early intervention and family-centered programs to school-based interventions can present a number of difficulties that can compromise the effectiveness and caliber of the behavior support. Early intervention programs are a relatively new concept for very young children who exhibit problem behavior or who may be at risk of social emotional disorders. Local community mental health organizations and the private professionals and therapy programs created expressly to meet the needs of the children exposed to particular risk factors can all offer services to children and families. The aspects of the early intervention are family-centered, partnership between families and professionals, assessment-based, positive behavior support, and successful participation in an inclusive environment. So the family, they need to ensure that the family needs, concerns, and priorities guide all intervention efforts. Partnership, development of family-professional partnership. Although intervention efforts for young children need to be centered on the family's needs and preferences, such efforts cannot be developed in an optimal way unless they are informed by professionals working in close association with the parents and other family members. Also, assessment. Effective behavioral intervention efforts use an assessment-based approach to understanding and intervening in a child's challenging behavior. In this type of approach, problem behavior is viewed as being functionally related to stimuli that can be identified. And last thing is inclusion. So successful participation by the child and the family in the range of community environments that are common to young children and their families from young age. Children need to learn to interact comfortably and successfully in diverse social circumstances.
Humpage argues that disabled people developed the social model of disability because the traditional medical model did not explain their personal experiences of disability or help to create more inclusive ways of living. This is crucial because it critiques the medical model of disability, which focuses on what is wrong with the person other than what the person needs. In comparison, the social model of disability emphasizes that disability is caused by the environment or by the way society is organized, rather than by a person's impairment or differences. It looks for ways of removing barriers that restrict life choices for disabled people. When barriers are removed, disabled people can be independent and equal in society, with choice and control over their own lives. As a result of the medical versus social models of disability, as contemporary teachers, we should have a growth mindset and positive attitudes towards our diverse learners. They might need additional support by removing the barriers and being supported to fully extend to their potentials to learning. Now, I will hand over to Sonia to discuss monitoring and documenting children's development.
It is important to monitor the child's behavior through observation and document it in a respectful and sensitive manner. Some ways that we can achieve this is by using tools such as developmental milestone red flags, as this is a document for supporting and recognizing developmental concerns early, or we can use the Victoria Early Years Learning and Development Framework as to guide us in a professional manner to support children and families. We can also monitor children's development through daily observation of the child playing and engaging conversations with families at pick up or drop off time. We can also keep records of concerns for behaviors and conversations with families and professionals. For example, at my center, we are having a communication book between educators and families, and we also have a folder to keep records in a confidential manner. We also can hold room meetings and discussing with the educators, so we can have a high communication between staff and supporting monitor and documentation. On the next slide, my team member Irene will be discussing about strengthening relationships with families and educators.
The next step is strengthening relationships. Consistent communication with all parties is crucial in this case. Check-in phone calls and communication books are open so that the family and all parties involved can be aware of what is happening. Care team meetings can be held whereby safe spaces are created and all parties involved are free to offer their opinions, and where the links with other professions are also open. This way, we all listen to the approach sensitively and carefully because we want to do it with empathy and with no judgment to any party. The aim of this approach is that the family needs to choose the best approach that suits the family needs best. Jignan will now talk more about the early intervention services.
I will give a brief introduction to different therapists that are normally involved in the early intervention program. Speech therapist. The therapist works with the family to develop children's verbal and nonverbal communication skills. The support includes assisting children to develop receptive and expressive language skills, facial expressions, gestures, and body language to help in communications. The therapist will also focus on providing visual support and developing programmatic language and social skills. Occupational therapist will help children to develop their fine motor skills, gross motor skills, sensory skills, social skills, self-help skills, cognitive skills, and visual perception. Psychologists will focus on assisting children to increase their positive behavior and providing strategy for family to manage difficult behaviors. They will help children to identify their emotion, perception, and reduce anxiety and mood. They will also provide to help to develop children's social skills and cognitions. Other therapists may be involved in the program, which based on each child's individual needs. They could be physiotherapist or combined therapist. So next, Aaron will introduce IDF funding and other support that children and family may receive.
The IDF provides funding to assist service to address a barrier to inclusion that cannot be addressed by the support of an inclusion agency. There are 4 streams, and I will focus on discussing IDF funding subsidy for an additional educator and time-limited support. When there is an inclusion case with a medical diagnosis, usually service is encouraged to apply for the IDF subsidy for funding an additional educator to increase the educator-to-child ratio. This enables the team to implement the strategies in responding to the barriers identified in the particular care environment. This ongoing support can last more than 12 months. In relation to an inclusion case without a medical diagnosis, services are encouraged to apply for the IDF subsidy for time-limited support. It enables the service to quickly engage an additional educator where there is an immediate barrier associated with high support needs. This is a limited period, normally lasts for 12 weeks, and the IDFM assess the applications for the funding. The service is notified of the outcome within 5 business days. If you'd like to know further information, please refer to the IDFM website. Now, let's welcome my team member, Sonia, to present to you with ECIA National Guidelines.
Early Childhood Intervention Australia provides services and support for children that have developmental delay or disability. It has the aim to help families and professionals to provide a meaningful environment for the children with additional needs. Early Childhood Intervention Australia focuses in 4 quality areas. The first one is about family. Family-centered and strengths-based practice. It means the educators working closely with the families to contribute and develop strategies for children who needs additional support. And also culturally responsive practice for educators to make family culture inclusive through practice, such as getting families involved, celebrate important event days, set up cultural activities, and involve culture in story time. The second quality area is about inclusion. So to be inclusive and participatory practice is to embrace every child into the program, to participate equally into the daily activities, regardless their needs, and also engage the child in natural environments. Natural environments in this case means a place where the child can further develop their skills and learning, such as early childhood centre, the community, and their homes. Quality area number 3 is about teamwork. Collaborative teamwork practice. It is important for the child with needs that early childhood educators and families work side by side, communicating with each other and making decisions together. And the capacity building practice by, for example, running training sessions to give more information about the child's needs and interests, or having regular meetings with the parents. The quality area 4 is universal principles. This is about evidence-based standards, accountability, and practice. These are services that can support families during assessment, such as National Disability Insurance Scheme, also known as NDIS. And the outcome-based approach is based on focusing on what parents believe and is important for their child and help to identify skills to achieve it. On the next slide, my team member Jean will be discussing about a friendly classroom.
As a contemporary teacher, to better support children with ASD, collaboration with the families and the therapist is one of the essential elements. Creating ASD-friendly classroom is another important element to support children with ASD. There are a few tips that may help. 1. Have a fixed and consistent structure or routine. Most of the children with autism strives in a structured environment. Try to identify the structure clearly with children to create a secure and comfortable environment for them. 2. Use a visual tool to help children to learn. Most of the children with ASD are visual learners. Therefore, visual timetable can help children feel in control and secure about how their day will be. 3. Reduce the distractions. For example, avoid changing the furniture position in the room and positioning children away from the window to minimize the interruptions. 4. Use a short, simple, and clear sentences when communicating with children with ASD. 5. Smooth the transition. For example, give a clear and gentle warning to children with ASD before change one activity to another to help them to reduce anxiety and stress. 6. You always use a positive reinforcement to increase the desired behavior. 7. Give clear instruction or teach with a list when teaching children with ASD. For example, demonstrate the process visually with a picture or list about how to build a sandcastle in the sandpit. 8. Be creative in your teaching. 9. Set up a special area for children with ASD to settle down when they feel overwhelmed or uncomfortable. For example, set up the quiet box or dark corner in the room. So next, our team member, Irene, she will sum up our presentation. Thank you.
As contemporary teachers, our approach to inclusive learning can be creative. We recognize and respect diversity and will incorporate all possible resources, services, and support in early childhood education to ensure all children have the learning, development, and well-being outcomes they need for school and for future life. Thank you.